4-year-old man, a young man for that matter, with burns from electrical burns affecting your neck, affecting your back, affecting, oh, can you imagine? Even the left side of your arm and your forearm. All you were trying to do was to attempt to fix a basketball net. While you were assembling it, that basketball net, hey, by mistake, it accidentally touched a high tension cable wire. And as a result, you sustained electrical burn injuries. Thank God that you did not lose consciousness. You did not faint, according to the layman. You did not lose consciousness. But, of course, you convulsed. You had seizures, which lasted for just about 3 minutes before it stopped. Thank God you didn't have any other injuries, and thank God you can see well. There was no difficulty or blurring of your vision. And thank God that you didn't pass any black urine. Thank God that your heartbeat feels normal. Oh, what else? Thank God that you were immediately rescued and taken to a private hospital where at least they did something, Sha. They gave you antibiotics. They dressed your wound with dermazine ointment, otherwise known as silver sulfadiazine ointment. And thank God that you're a young, healthy man before now. Hey, before you sustained this electrical burn injury. And you had never ever had any form of surgery in the past. Mr. Young Man, you don't have any drug allergies. And you are not pale. You are not warm to touch. You didn't have any fever. And your blood pressure was normal. It was about, let's say, 140, 80 millimeters of mercury. The higher one, 140, we can assume that that high systolic blood pressure, maybe it was because you were a bit anxious and you were in pain when they rushed you. And so, at the hospital, you were assessed to have a head and neck burns of about 2%. This your left arm and your left forearm. You were assessed to have a total body surface area affected by the burn of about 6%. And of course, the back, your back, the burn wound was assessed to be about 5%. So all in all, my young man, you were assessed to have about 13% total body surface area, mixed thickness burns injuries, secondary to electrical burn injury. And most of these burns were what? Yes, at least, well, can we say it's more of superficial or more of deep partial thickness? You tell me, my medical fans. Thank God that as you are resuscitated now in the private clinic, they now rushed you to an acute burn center where you were given the proper treatment after assessing the amount of burns you had over your body. And you received immediate treatment with dressings, antibiotics, hematinics, elevation, and all sorts of things. But then what are all these things on your back? Can you see these yellow things on this young man's back? Even on his neck, can you see these yellow things? On his face, on his neck, on his forearm, on his arm, and especially over his back? We can see that some of the burns injury is even beginning to even heal self. But could this be a crust, C-R-U-S-T, forming on this burn wound? Is it a pseudoeschar? Is it what? A scab? My medical fans, I know that you're confused as to all these terminologies. But medical fans, there are some of you here that are health professionals. And let us discuss whether these yellow things that you are seeing on this healing burn wound, are they crusts? Are they pseudoeschars? Are they scab? Because what is a crust, Seth? What is a crust when it forms on a burn wound? It is important to understand the difference between a crust and an eschar. Because, difference there, the difference is great. One is made up of dried exudate. Dried exudate. Exudate meaning that water that comes out from your wound. And that exudate, it implies so many things. The other one, the eschar, it is made up of mainly dead tissue. And this dead devitalized tissue is as a result of some level of death of the skin and the underlying tissues. But crusts, crusts on the other hand, they are composed of like dried blood, serum, and also dried exudate. But then what is a pseudoeschar? On the other hand, a pseudoeschar, it is a thick, gelatinous yellow or tan film, should I say, tan or tan film is like a film that forms when we apply silver sulfadiazine or dermazine cream. When that silver sulfadiazine cream or dermazine cream combines with the exudate that is coming out of the wound, it can often be mistaken for eschar. But you'll find out that when you try to remove it using maybe gauze, using some instruments, it can be removed with this kind of mechanical debridement. So all these burn wound terminologies, they're important for us medical professionals. And of course, for some of you medical fans that are not into the medical terminologies, but you'd like to find out more. And so, what is a scab, on the other hand? A scab is a dry, crusty residue which accumulates on top of a wound, resulting from maybe clotting of blood, maybe discharge like pus, maybe serum coming out from the wound, and the combination of maybe any of these things, the blood, the pus, the serum. How about the pseudoeschar? We don't already talk about it. Pseudoeschar is a thick, gelatinous or tan yellow film that forms when silver sulfadiazine cream or dermazine combines with all of these things. The exudate, the discharge, the pus, the blood, the serum. So, as we're seeing now, this one now, NASCAB, is it a pseudoeschar? Is it an eschar? Is it, what do you think it is? My medical fans, tell me in the comment section below. Because we have already said that. What is a crust in medical terms? Crust, dried serum, pus, or blood. Isn't it? Does this look like a crust? Yes, it looks like a crust somehow. And crusts, mind you, they're not only seen in burn wounds, they're also seen in diseases in which the skin will weep, like all these then, eczema, impetigo, and seborrhea. They are often yellow-brown, dirty cream, or even honey-colored. So yes, crusts are found on superficial or partial thickness wounds. And let me talk more about this crusting. It is the rusty brown dry crusts which forms over any injured surface or skin. Sometimes even within 24 hours of injury. Whenever our skin is injured because of any cut or any abrasion, it starts bleeding because of the blood that has been, flowing from those vessels, our blood vessels that have been injured from this burn. And this blood contains some materials like platelets, fibrin, and blood cells. This will soon clot, just to prevent further blood loss. As this outer surface of this blood clot dries up, that means that it dehydrates to form a rusty brown crust. This is called a scab. and it covers all these underlying tissues like a cap. What is the purpose of a crust or a scab? The main purpose of a crust or a scab is to prevent further dehydration, drying out of the healing skin underneath, to protect this healing skin from infection, and to prevent any entry of contaminants from the external environment. Crusts generally, remain firmly in place until the skin underneath has been repaired, and then new skin cells have appeared, after which it naturally falls off. So, why is my burn yellow and crusty? We have explained that one, Abby. If you don't really understand, go back to my explanation. You'll get it. Remember that if bacteria get inside this wound can be infected, and this can cause a crusty yellow scab to develop. Medical treatments and home remedies may help, but only for very small wounds. I beg, for burn like this, make it go hospital. We don't really talk say a scab na a collection of material like blood, skin cells that forms as a protective layer over the damaged skin. All this skin injury, it will cause all these reactions from the skin. Remember that the skin is composed of all these proteins and other tissues, tissue components that work like a tap that will cover the wound. Crusts are also formed, of course, when certain bacteria like streptococci attack the skin. As this body does its own healing work on the inside, a dry temporary crust, this scab, forms over the wound on the outside. And we know that the scab's job is to protect the wound as the damaged skin is healing underneath. Thank God, say underneath this scab's protective surface, new tissue will form. So, my medical fans, do you know the difference now between a pseudoeschar, an eschar, a crust, a scab? I beg, listen again to this video if you still don't understand it. And tell me what you think in the comment section. Don't you want to not get sick? Click in the comment section. I'm going to pin just below this video to find out how not to get sick. Watch the next video coming very soon. I love you all, and bye.